Speed is a very structured platform. There is everything is very to the point. The grand tests, the Q banks, and the videos as well. Though, I couldn't completely see all the videos, but by and large, the question banks, the test series, and the explanations by and large were on point. And I mean, that is what mattered in the last 2 months. I mean, I could revise, and, the concepts which were, weak, that were covered through the Q banks and the grand tests. Thank you to the entire speed team for for helping me get this. So forever grateful.
So I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute to Dr. Rishabh Agarwal for scoring a topmost rank in NEET SS DM Medical Group of rank of 218 in NEET SS 2025 session. Congratulations to you, Doctor.
Thank you so much, sir.
So I thank you for having you in this session and sparing your time to share your valuable experiences with us and also to the students who are watching it.
Yes, sir.
And can we know your brief background history from where you started, what all you have done till date?
Sure, sir. So I graduated from Government Medical College, Miraj, which is in Sangli, Maharashtra. I did my MBBS from there, followed by DNB in internal medicine from Breach Candy Hospital, Mumbai. So that was my post graduation. And then in the very first attempt, I have secured an AIR of 218.
Excellent, congratulations. And you have done an amazing job and accomplished great in your medical career so far. What is your interest in super specialty in DM Medical Group?
Sir, I intend to pursue medical gastroenterology.
Medical gastroenterology, why medical gastroenterology? Why the special
Yeah.
interest towards it?
So the interest, basically, there was quite a bit of buzz about it, but the interest actually came when I actually attended my postings in gastroenterology under renowned gastroenterologists practicing in my hospital, where seeing OPDs, seeing the procedures, seeing the therapeutics in gastroenterology, and I felt that I need some intervention for my personal career in future. So a mix of OPDs plus a minimal of intervention is what suits me according to my personality, and that is why I've chosen to pursue gastroenterology.
Great, wonderful. It's an amazing specialty, and I feel that you have chosen to pursue your super specialty. Very nice to know it. And once you have decided to do a super specialty, and how you started, prepared yourself mentally, and how you started working towards it, what was your preparation strategy to achieve your rank today?
So, sir, it started from the second year initial part when we were in the super specialty postings. And then comparatively, we used to, get a bit more time. And that is when I decided to, actively give at least small bits of hours to my preparation. Not hours, it may be 20 minutes a day or, sometimes 45 minutes, but consistency was that which was very important, and that I continued for the entire second year. In the third year, it was academically quite engaging for me because of the DN theory practicals. And then once the exams got over in October, I had a good 2.5 months to give it a good chance by revising all those concepts which I had built over 1.5 years.
Great. Really nice to know the way you have worked towards it. And how many questions did you attend this exam?
So I had attended 146 questions.
Great.
Yeah.
Can you
So,
share something about this paper? I mean, what was the paper
so,
about? Is it of more
so,
of
so,
content or a single?
by and large, if I would to rate the paper, it was towards moderate difficulty, especially the third part, which was, which came as a surprise for everyone because no one actually would have, prepared for the environment, for the toxicology in such depths which they had asked in part three. So, reading between the lines, keeping calm, and then they had repeated quite a lot of similar sort of questions on environmental medicine, heat medicine, and heat stroke. So all those things you needed to have your concentration calm at that point of time. Apart from that, part one and part two were by and large, I think, very standard. They covered all the basic concepts of all these specialities, and if you would have solved your grant tests and the Q banks, I think the first two parts, apart from some questions, were not that difficult.
Okay. So who introduced speed to you? What was your experience with speed for preparing for this exam?
Well, so my seniors, were who had already benefited from speed, who had acquired good ranks and had pursued, super specialization, DM, cardiology, and all those fields. They had, told me that speed is a very structured platform. There is everything is very to the point. The grant test, the Q banks, and the videos as well. Though, I couldn't completely see all the videos, but by and large, the question banks, the test series, and the explanations by and large were on point. And I mean, that is what mattered in the last 2 months. I mean, I could revise, and, the concepts which were, weak, that were covered through the Q banks and the grand tests.
Great, doctor. Thanks for sharing. And faculties of speed will be very happy to listen to the words from you. And and what will be your message for the students who are aspiring for DM superficiality?
So my message for them would be to be consistent and focus on small bits of daily reading, building strong concepts, reading Harrison tables properly, going through the minute intricacies of all the tables, because that is what stays in your mind rather than reading all the texts. So that is number one. Number two, be clinically very sound. Clinical acumen is very important, and that will only build through seeing cases, seeing patients, and reading clinical books. So that is the second part, because at the exam hour, it is a culmination of not just MCQs, theory, practicals, but everything. Your wards, your ICUs, whatever you did over your past 3 years, that is what will take you across.
Great. Now, time to thank and whom all you want to thank that they have stood by you, helped you till date in your career.
So majorly, number one, my mentors, my HODs at Breach Candy Hospital, Dr. Farooq Kutwadia, who's 96-year-old. He's a veteran in internal medicine across India. He was my guru. And secondly, Dr. Prateet Samdani was my mentor. So these two, because of their dedication towards the field, and secondly, their rounds, their explanations, their teachings, their OPD teachings, everything, every question, every scenario, case-based scenario, I could actually, because of their teachings, I could do it at the way it happened. And secondly, my parents, my father, Dr. Anil Agarwal, and my mother. So they motivated me throughout my journey, as well as my seniors, who constantly guided me towards what to do, what not to do, where to spend your time during your preparation. Don't overdo your theory. Don't get overwhelmed. Focus on important things. Focus on questions, concepts, revisions, smart revisions. So yeah, all of these people, my HODs, my gurus, my parents, and my seniors.
Great. Nice to know. And you could recognize all of them and thank them. It's great. So once again, we wish you all the very best and all the success for a great career in DM superspecialty of gastroenterology. And as a gastroenterologist, you touch millions of life. For that, advanced wishes and congratulations to you.
Thank you so much, sir. Thank you so much. And thank you to the entire Speed. team for getting, for helping me get this. So forever grateful.
We are blessed to have you as a student. And we
Thank you so much, sir. Thank
really
you so much.
love, love the way you have done your progress.
Thank you so much.
And we are very, very happy for you.
Thank you so much. Means a lot, sir. Thank you.